Viewers, welcome to another episode of Monitor Your Health, a program where we try to educate the public on health issues of concern. Today we have a very interesting topic, and again, my name remains Dr. Femi Ogunremi. We have in-house Professor Rotimi Jaiyesimi, who will be talking to us and breaking things down for us on patients, rights. Do we really have a right? However, before we answer this question, let's get Prof to actually introduce himself. You're welcome, sir.
Thank you for having me on the program. I am Rotimi Jaiyesimi, Associate Medical Director for Patient Safety and a consultant in obstetrics and gynecology at Basildon Hospital. In addition to that, I wear other hats. I'm adjunct professor of law at the University of Ibadan in Nigeria, and I'm the chief executive of Trojan Medical Group. So those are at least some of what I do. So thank you for having me. Good evening.
Very much welcome, sir. So, as an associate professor of law, I thought this topic is better handled by you because patients generally, we have a lot of, how do I put it? There are a lot of concerns as to when a patient goes to see the doctor, they ask the question, what are my rights? What do I need to do? What can I do? What do I not do? I mean, what can I not do? So if we are to actually understand that, what does patient right? What does it actually mean, sir?
Right. I think I will take us back a little back in history, what we call medical paternalism. Many years ago, and probably currently in Nigeria, the patients tend to take what the doctors and nurses tell them, irrespective of whether it's convenient for them, it's what they want or what they don't want. And it's something that happened in the West, but no longer occurs. And the way people went away or put medical paternalism away is to say, I as a patient, the body belongs to me. It's my body. So I have a right over my body. What you do to me, what I want from you, what I accept from you is my right. And patients' rights really is not a new thing. We've got the Human Rights Act that protects the individual. That is, you make a choice as to what happens to you, what people can do to you, what you can accept from people. So just to summarize it is to say the patient is at the center of the care that they receive. The patient has a right for what is done to them. So they can say yes, they can say no, they can listen to your advice and decide they don't want it. So in Nigeria, and I think in other parts of the world, this is an important topic. Even in the Western world, it's a topic that's still been discussed. And people are encouraging what we call patient-centered care, or involving the patient in the decision-making about their care. And let me just give an example. I could have, maybe, it's going to be a simple example. Let's assume I have a growth growing on my face, definitely not a malignant growth, even if it's a malignant growth. And I tell the doctor says, oh, you need to have this removed. And I tell the doctor that, no, I hear what you say, but sorry, I'm not going to take your advice. That is part of patients' rights. And I know going down the line, going down the discussion this evening, we will be talking about things about access to medical records, access to information. So I will leave it as that the patient owns the body. So it is their right, whatever is done to them, they make that decision, not the doctor or healthcare professional.
Thank you so much. So it's very interesting, to what you have actually touched on, because when we look at, I would generally say maybe developing countries, there is that, attitude, maybe it's an attitude or it's a culture whereby a patient comes to see the doctor and the patient just expect the doctor to make all the decision. And I know I've engaged with colleagues in Nigeria where we've dabbled into some ethical, issues. For instance, in cases where you have a lady who is pregnant and maybe she's had 5 children before, and then they're thinking, oh, this patient might need, family planning, which might be a permanent family planning. And there are issues where instead of discussing with this particular lady, people go and discuss with the husband or discuss with husband's family. And I remember there was one serious conversation I got involved in, whereby senior colleagues were telling me, well, this is Nigeria, that's how it is. The person that is making payments is the one that they're gonna discuss with. Well, what's your view about this, sir?
That view is absolutely, and when I say absolutely, I'm saying 100% incorrect. The person paying the money has no say in what happens to the wife or to the husband or vice versa. Like we said, it is entrenched in law that before you do anything to a patient, that patient, for as long as the patient has mental capacity, has a right to decide what happens to them. People who say, oh, this is Nigeria, we can do anything, please let me tell them that it is absolutely incorrect. If they go to the Medical and Dental Council website, they will see that they cannot do that. If you want to go down the Human Rights Act, which is a global convention, they will see that they cannot do that. And the 2018, there's a National Health Act that was released about just during the Jonathan Goodluck's time, also protects the patient. And then there's the 2018 Bill of Rights of Patients that was released in cooperation with the Federal Ministry of Health and the Consumer Protection Council of Nigeria. Mark the word, Consumer Protection Council. So the patients are clients, they are like consumers, and the Consumer Protection Council of Nigeria, working with the legislative and executive arm of government, have come up with these things, what we call the patient's right. So my advice to our colleagues is this: the days of medical paternalism has gone. The lawyers are watching us in Nigeria in terms of medical negligence, in terms of performance issues, misconduct, and all they have to do is to report to the Medical and Dental Council of Nigeria. Let me just diverse a little bit from what we're talking about. And I don't think it's a diversion. I listened to the health minister this evening talking about patients not being treated in this COVID era. And the advice is doctors who refuse to see patients, not COVID patients, but patients who attend their hospital and who refuse to see them, if they're reported to the MDCN, they may be struck off, because that's a breach of the duty of care that one has to the patient. So I know it does take time for change to happen, But a webinar like this is supposed to educate both the patients as well as the professionals delivering care. The very fact that we went to medical school or nursing school or whatever profession doesn't give us the right to make the absolute decision about the care a patient receives. Neither does the spouse have a right in what happens. An adult who has got mental capacity is the one who makes the final decision about what happens to them. So that I'll leave it as that so we can continue our discussions.
Thank you so much. I'm actually loving it because there's a lot of information that you're pumping out there, which I really appreciate. Now, you mentioned something. You talk about mental capacity, because I know that people will be asking, okay, what is mental capacity? He's talking about this. So as long as the patient has mental capacity, then they have a right to, decision and rights, to be treated or to prevent treatment. I'll set an example, sir. I was working, this was in the UK, I was working in an hospital as a senior doctor, and then a patient walked in. This patient actually took an overdose of paracetamol, and he needed treatments. But when you talk about mental capacity, assessing this patient's mental capacity, I realized he had a capacity. I was really worried about the patient, of course, because the amount that he's taking is going to finish his liver. And obviously, the consequence is not something I want to think about. I was quite worried. I had to pull everybody together, including the psychiatrist of course this day. And that's the day, it was really dawned on me, because eventually we had nothing to do. We couldn't do anything with this patient because he was clear about what he wanted. He had overdosed himself. We're worried, but he had capacity, and he could tell us clearly. We had to respect his opinion. So I want us to throw more light on this mental capacity. What does it mean?
Okay. Mental capacity is the fact that, one, you're aware of your surroundings. You're not severely depressed. Your cognizance is intact. And you have no mental issues. And you can make decisions. You know where you are. You know who you are. You can do a simple mini mental assessment test. Somebody who comes in drunk, somebody who comes in who cannot talk, who is delirious, or people with dementia and Alzheimer's, they've lost their capacity. But somebody who knows their name, where they are, their date of birth, those are simple ways of testing somebody's mental capacity. And I like the example you give, but let me also give this example, which I think people globally will understand. The Jehovah's Witness. The Jehovah's Witness have it in their policy that they are not allowed to receive blood transfusion. Under any circumstances will a Jehovah's Witness receive blood transfusion. And even at the point of death, when you tell them that, look, the only thing that will save you is to receive transfusion, they will not take it. And for as long as they know the consequences that not taking it might result in death, then there's nothing we can do. And that is a patient exerting their right to what happens to them. We look at the people who, talking about euthanasia, people traveling to the continent, the European continent. Euthanasia is not allowed in the United Kingdom, but in the Scandinavian countries, it is permissible. And for as long as that person has got the capacity and decides that they want to end their life because of chronic illness that they are not going to survive from, the people in the continent do it. So effectively what we're saying is any human being, especially adults, we're not talking of children now, we're talking of adults, not children, because minors the responsibilities of minors are the parents. So let's perhaps restrict it to adults. For as long as they have capacity, then they decide what happens to them.
Thank you so much. So I think you're just shining lights on the path I'm going to go. Like you're talking about the children now, because one other major thing is obviously even in Nigeria, people will come and then they bring their child. There are situations where maybe I should touch on this first. Situations, an example where a patient will go to the hospital scared actually, because some people will say, when we get to the hospital, we're really scared about the nurse. They're very, very frightening. They're scared about the doctor, the way they talk to me. Personally, I've had encounter or engagements in one of the hospitals, or some of the hospitals, even in Nigeria, where you go to see a patient and the way doctors would probably sometimes when they don't know you are also in the medical profession, the way their attitude towards you, even as a patient or as a relative of the patient, you just wonder why this? You know, does that inch on the rights in a way by which we talk to our patients, the way we react to them, or the way we actually handle them, you know, during the process of delivering care? How does it work?
I think it's an issue that really hurts me. You don't need to be a doctor to respect people. In the patient-doctor relationship, and let me qualify, when I say doctor, I want the audience to know that I'm talking about all healthcare professionals. It's difficult for me to say pharmacists, doctor, nurses. So I'm not just saying it about doctors alone, but the healthcare professionals. You have to respect human beings. The fact that they are in a vulnerable position because they are patients. When somebody is ill or has a disease or a complaint, they are in a vulnerable position. The doctors, the nurses are in a higher position. So it's almost like a power play. And that's what led to paternalism, where the doctor thinks, you know, years ago, they used to say doctors are next to God. We are not next to God. And what you said hurts a lot, because we have to respect ourselves as individuals. And like you said, you've spoken to colleagues, and I've also seen that as well. And I have visited hospitals that I'm associated with in Nigeria, where they don't know me, and I do what I call misery shopping. I go in there, I don't tell them who I am, I just want to see how they will treat me. We as healthcare professionals have to respect the dignity of people who are ill. Talking down to them, shouting at them is misconduct and should not be tolerated. It is something that we should not allow in any healthcare facility. A nurse, a doctor, a pharmacist has no right whatsoever to talk in a disrespectful way to patients. And that is covered in the Bill of Rights for Patients. And I think with more education, and when we have more cases that are highlighted in the press, I think people will get the message. Our colleagues in the healthcare industry will get the message. The current campaign in Nigeria is Say No to Rape. I would love to see another campaign. That is a very good campaign, Say No to Rape. We also have to launch a campaign about the respect we give to our patients as doctors, nurses, pharmacists. It starts from the gate man. You get to the gate of a hospital, even the gate man disrespects you, doesn't welcome you well. And when I use that word welcome, it's just triggered something in my mind. You know, in the United Kingdom, where you've practiced as well, and you also still practice, They say the first 10 steps you take into a health facility, you will know the quality of care you're going to receive. How the gate man welcomes you, how the receptionist welcomes you, will tell you a lot about the quality or the culture of that hospital facility. So when I say it pains me when doctors talk down to patients, it is not acceptable. And one of us or all of us, one day in our lives, will be patients. And I remember medical school, where one of my lecturers, and I'll mention his name, Professor Ladipo in Obs and Gynae. The question you should ask yourself as a doctor, if this were my wife, if this were my cousin, if this were me, how would I want to be treated? It's the way you should treat your patient. That's the way you should treat your patient. What you want people to do to you, the respect you want people to give you as a doctor, is the same respect you should give to your patient. So I think, so we can go into more topics. I hope I have tried to throw light on that issue. Disrespectfulness, talking down to patients, talking at patients is not the right way forward.
Thank you so much. So at this juncture, I think we should have a minute or 2 minute break. I'm just going to, play a clip from our sponsor. So I'm going to share my screen in a minute. Sorry. Okay, so let's play that for it. Thank you so much. AreaDoc is an app where it can be done. You can download it on, in app stores or Play stores, and it's a free access to doctors where you can chat, you can call, and interact with people like ourselves. So thank you so much, Prof. Thank you again. So the topic we're dealing with today is on patient rights. And we've defined what patient right is. We talked about what patient's capacity is. The Prof has told us that, a capacity testing is quite important, whereby patient is given information, they're able to, process this information, they understand it, they're able to produce it back to us. And then once they go through that process, they have a right. And they have a right to quite a lot of things. We're going to go down the route of some of the rights that the patient will have now. And especially we talked about, aggression towards patient, the way we disrespect our patient, which it's just not, just not the right way to go. And so next we will be talking about what are the rights, what are these rights that we're talking about? Because as a patient I've walked in, I don't even know. Yeah, what are the rights? Is there something to guide us on knowing what our right is as patients?
Yeah, like I said, the Ministry of Health, in conjunction with the Consumer Protection Council, issued 12 bullet points about what patients' rights are. I could either go through the points briefly, or if we want to be comprehensive enough so that people do know what these rights are, it might just be, we'll try and paraphrase them. And so don't mind me reading through the script that I've got. The very first one says, the right to relevant information in a language and manner the patient understands, including diagnosis, treatment, and other procedures. Now, I'm sure you have this experience where patients ask doctors, what's the name of the drug you're giving me? And the doctor says, you don't need to know that. I'm the doctor. Just take what I give you. That is not the right way to practice. The patient needs to know the diagnosis. The patient needs to know the treatment choices you're offering them, and they make a decision as to whether it's surgery they're going to have, or whether they'll go down the path of medication or have nothing done at all. So that is one of the patient's rights. They should be involved in the decision making about their care. The second one here says access to detailed and accurate medical records and available services. I have an experience, and this is about access to records. The records, the case note does not belong to the hospital. The case note contains the information of the patient and belongs to the patient. And I've got experiences where doctors have said, no, we can't even give another doctor information, even though the patient has given consent, saying things to the effect that, oh, the records belong to the hospital. No, the records don't belong to the hospital. And the patients are protected by that right, saying any information, whether it's the scan result, CT result, chest X-ray result, even their case notes, they have a right to it. And let me say something to my colleagues at home. You know, patients, everybody now has a cell phone that contains a recording device. People can record a consultation. There's going to come a time where globally, patients will be allowed to record the consultation process. So if you think you're not going to give a patient the case note, be mindful of the fact that they could be recording the discussion. The way you're talking to them will come out in any recording. You may say it's a covert recording, but there's going to be a time when it should be allowed and acceptable that patients can record without telling you the conversation. I'll go quickly through. In private practice, you've got to be transparent about your bill, the right to privacy and confidentiality of medical records. In Nigeria, people, we do talk loud. The patient next door to another patient really shouldn't be hearing what you're discussing. Corridor discussions, no. You have to be, uphold confidentiality when it comes to information about patients. And you don't leave medical records lying around or where cleaners or other people can see it. That is one of the rights. The right to a safe, clean environment. That is very crucial. Most of our public hospitals are not clean and they are not safe. And when they are not clean and safe, patients have a risk of acquiring hospital-acquired infection. A hospital is supposed to be a place of cleanliness and safety. So that is one right they do have. And I have highlighted one here that says the right to be treated, which we've spoken about, with respect, regardless of gender, race, religion, ethnicity, allegations of crime. If somebody is brought with gunshot wounds, you still have to treat that patient with respect. If prisoners are brought from the prison wall to hospital facilities, the fact that they are prisoners doesn't mean you should disrespect them or economic circumstances. Then it says the right to reasonable visitation, the right to decline care. We spoke about that. A patient can say, no, doctor, I hear what you say. I hear the diagnosis of cancer. You've suggested XYZ, but I'd rather I don't have any of that. The patient has a right to decline or consent to participation, again, in medical research. Of recent, we've heard about whether it's fake news or true news, we don't, about people wanting to come and do COVID vaccine research. They need the consent of the patient. It's the body of the patient. Then the right in quality care in accordance to prevailing standards. Then the right to complain and express dissatisfaction regarding services received. So those are the 12 rights patients have. And just to try and summarize it, what it's telling us is that we should respect our patients. We should treat them with dignity. We should take on board their own views as well. Home circumstances, as they've got that dignity. And whatever you want to do to a patient, the patient must consent to it. Failure to receive consent from the patient in the old age is called battery, and it's a criminal offense. If you do something to a patient, take a patient to theater, unless in an emergency, without the patient's consent, that is a criminal offense, which may lead to the loss of one's professional license. And I know you're into quality care. I mean, quality care, we give what I would say.
Okay, sorry, we lost you for a few seconds there.
Oh, you mean the last few seconds?
Yeah, when you talk about you're in quality care.
Yes, yeah, the quality of care. The quality of care is not just a surgeon who's done a perfect job. The quality of care starts from when they enter your hospital, how you treat them, how you talk to them, even the food you give them, the facilities for hygiene, the bathrooms, the toilet, all of that contributes to the quality of care. And when we talk of quality of care, you will be conversant with patient experience. Patients see what's going on. And you know, the last number 12 in the Bill of Rights says if a patient is dissatisfied, they can complain. They can complain to the MDCN, and the MDCN will take it up seriously. They can complain to lawyers. And one area we haven't touched upon, which is a very, very sensitive area, is the relationship between doctors and patients in terms of intimacy, sexual relationship. That is a no-go area. The patient has a right of dignity. And because you are the doctor, you should not, it's exploitation if you do that. The patient is vulnerable. We're talking of patients' rights, and that's why I'm talking about this particular subject. The patient is vulnerable, they need help, and you are now in a coyish way saying, unless you do this to me, you wouldn't get this, or if you do this, you will get this. It's not the right way. It shouldn't be encouraged at all.
Thank you so much. Right, so there's quite a lot in there, and for our viewers, I will get these 12 points, get it on on my Instagram page. So if you follow me on Dr. Femi Ogunremi on Instagram, you will find this on my Instagram page, where I will publish it this evening. Now, thank you so much, Prof. You touched on something, and I think it'd be good for us to actually clarify that. We talked about the case leading to patient. Okay, now the patient's records is the patient's record as it sounds. But I want us to throw more light, because a patient can then go into an hospital and say, I need my record. I want us to probably tell them, because I know there is a process. If you're going to get your records, you can't just, of course, there's the Data Protection Act, but one of it is there is a process by which you can get, this documentation. You can't go to the doctor on duty and pull the record. I hope I'm right in that thinking.
You are right. It's not an immediate thing that happens. You make a request for your records. If it's a paper record, I mean, the request could be verbal, or it could be in writing. And it could be that you want it to have it in your own personal file, or you want it to take to another hospital. So, and yes, it might take a day or half an hour. If it's a bulky case note that you have, that may even take days before they make photocopies of it. If it's electronic record, then that might be easier to download and print off. But yes, patients, what I'm saying, patients, is not that you walk into a hospital and say, oh, I want my records, and you get it immediately. No. Like Dr. Ogunremi has said, there is a process to it. You have to request for it. And then the hospital will tell you when to come for it. Just like your reports as well. It's easier with reports when you go for your imaging. Most places have photocopiers, and they can give you a copy of your report, but you must ask for it. And in some places, especially in obstetrics, I would like you to tell me who holds the records in obstetrics in the United Kingdom.
Who holds the records?
No, who holds it?
That keeps the patient, actually.
Yeah, the patients have their case notes.
Yeah.
They hold it, they take it home, and when they're coming for their appointments, they bring it with them. And do you know how that came about? Is because medical records did not keep case notes properly. It was difficult to get records. Patients arrived and the records were not available. Medical records at 2 a.m. is closed. The patient is here. There's no information. And that's how it evolved. And it wasn't an easy thing. Oh, patients will lose their records. No, we haven't had situations where patients have lost their obstetric or maternity records. So the records belong to them.
Thank you so much. Now, we have about 5 minutes to round up this program. So there are a few questions that is being, sent across to us. So one of them is, let's go with this one. A lot has been said about patients' rights. Is there a good medical or legal treatise about physicians' rights?
Yeah, I mean, okay, if I understand what, physicians have the rights as well. You cannot, as a patient or a relative of a patient, be abusive or aggressive to healthcare professionals. That's unacceptable behavior. Just like we are pleading that healthcare professionals should respect patients. We also expect that patients who come to us should respect us and not abuse us or any member of the staff whatsoever. So, and if that happens, it can be a criminal offense as well. If a patient abuses or physically attacks a healthcare professional, they can be prosecuted for that. And that's the professional rights they have when it comes into the doctor-patient relationship.
Thank you so much. And then one more question is patients' bill of rights. If a patient is allergic to a certain medication, can the doctor override the patient's rights?
That's
a bit a bit tricky. A patient
no, it's not tricky.
Yeah.
The doctor who does that, I tell you, if the patient reports to the lawyer, you don't even need to go to the lawyer. Go to the Medical and Dental Council and report. A doctor has no right. Somebody who is allergic to some drug and you say, no, you are overriding it. What we're saying in this last 60 minutes is that the body belongs to the patient. And it's the patient who decides what is done to them, what they accept or not, for as long as they have capacity. So to the person who raised that question is, no, that is not allowed. And I hope there are doctors and other healthcare professionals listening in. It is not an allowed practice not to carry the patient along with you. You shouldn't even bring your own bias into all of these things. It's give the information to the patient, give them the options of care, the advantages and disadvantages of each procedure or tablet or medication, and let them make an informed choice, an informed decision.
Thank you so much for that. So obviously, you have a patient who is allergic to something. Of importance is you really need to educate your patient. You need to give them as much information to take an informed decision. After you've given them that information, you are sure that they've received that information, they've processed that information, they've repeated information back to you. Then you know they have capacity and it's their choice at that time, whatever they want. You can't override. Now, the next question is, how are the documents in patients? Some of these questions are quite tricky, the way this is being written. How are the developments in patients' rights affect the rights of physician and health professional? What are your opinion about this issue?
It's not a very clear question when you say, I think we've addressed it. The rights of a doctor is to be paid, have a good working environment, to be protected by the human resources department, the wellness, the mental well-being, making sure that there's no burnout, the workload is not too much. When you're unwell, you're allowed to take your annual leave or sick leave. Those are rights of the professional, but that doesn't impact on patients' rights. So professional rights will come under organizational behavior, the human resources department. Yes, medicine is a stressful profession, and we have to look out for each other. Don't overwork yourself, don't stress yourself. When you're unwell, if you don't feel well, you don't go to hospital. It's even wrong when you're unwell to go to hospital, more so if it's an infective illness. If you have a cold, you don't go to hospital because you could give that cold to patients. So talking of the rights of the professionals is to make sure that their well-being and mental health is not affected.
Thank you so much. So we will be rounding up now. I think we've answered so many questions in the lump of that discussion. So Prof, now having said all this, what's your advice for us as a nation? What do you advise, in terms of the practice that we do now, and knowing, the quality that we should be aiming for? What do you advise us?
I usually say, I have a mantra that I say, each Nigerian life is priceless. You cannot put a price to life. And our duty as doctors and nurses and other healthcare professionals is to save lives. And in doing so, we have to do it in a compassionate, caring manner. And that's where the quality of care, again, the skills, knowledge, and performance of the practitioners are essential. And that is why we go for continuous professional development, which operates in Nigeria as well. So I think my what I'll tell people, my colleagues, is that let's be kind to our patients. Let's treat them as human beings. Let's give them the best of care that we can give them in a very good environment, in a conducive environment. That's the package. It's not the tablets, it's how you treat patients. There's some they talk of psychosomatic issues. Even the psychology of the way you talk to a patient can help them get better. So my final word is the big Q. We talk of healthcare. We should be talking about quality healthcare. And that is what I would like every Nigerian visiting whether a public or private hospital should expect and enjoy in Nigeria.
Thank you so much. So it's been a very insightful evening for us, for me as well. And I hope that what we've discussed today will go a long way to impact your practice as a professional or caregiver. And for us patients, I hope we've picked one or two things here that is shown us, or that is signposted us to where we know our right lies. And as just an add-on to what Prof said, I want to talk to my colleague that anytime we deal with our patients, we should always think about ourselves. When I always say this during my teaching, if you come to me and I treat you and I can't go home and sleep, I would rather not treat you than to be in that position. I want to treat a patient that after I've left, I'm going home to meet my family, to sleep, to rest, and have a sound evening or day or whatever. We get into a situation where we start thinking about patients if we have conscience, when we have not treated them right. And not treating a patient right means that one way or the other, you've missed that right, one of the pillars of rights that we have just talked about here. So always put yourself in the position. A patient, for instance, has come, or maybe even relative, they've come, they brought somebody to you, and then maybe the person died. This happened. And then you talk to them rudely. You've forgotten that these people will leave and go home, and that thing that you have done is what they will keep remembering. So if you put yourself in the shoe of these people or this patient, then you know that you won't do that, because that's not what you really want to do. So not to waste your time, please let us put conscience into what we do to our patients. Thank you so much for listening today. Another episode of Monitor Your Health will be coming up on Saturday, where we'll be talking on Sunday, where we'll be talking about blood transfusion and things like that. Until then, I want to wish you a good evening and the best of the rest of the week. Thank you so much.
Thank you for having me on your program.
You're welcome, sir. Okay.